My name is Schwent, and today we're going to be talking a little bit about reducing waste in healthcare. Healthcare spending in the United States is increasing at an unsustainable rate. Policymakers, as well as consumers, are increasingly searching for ways to reduce these figures. A key way to eliminate waste without harming patients and reducing the quality of care that they receive is to pinpoint where waste is occurring and eliminate that. So where does it begin? Where does waste begin? Well, a study conducted by the administrator of CMS, the Center for Medicare and Medicaid Services, identified 5 primary categories where waste is consumed. Of these 5 categories, they contributed together to between 18% and 37% of the $2.6 trillion spent annually on healthcare in 2011. So what's the problem? What's the problem with having waste? The problem lies in the structural design of the U.S. healthcare system. It's difficult to reduce waste whenever the financial incentive is favoring volume over value. Furthermore, attacking waste can typically mean targeting someone's income, and we don't want to do that. So what can we do? How can we eliminate waste without taking money away from employers? Well, before we can close the gap, we need to identify the primary areas where waste is coming from. So these are the 5 primary categories. The first is failure of care delivery coordination. The second is overtreatment of patients. Third is administrative complexity, pricing failures, and then fraud and abuse. So we're just going to discuss a few of these. For example, overtreatment of patients. Overtreatment occurs whenever care is rooted in physician habit instead of patient health. So many unnecessary tests are ordered, procedures are performed, and surgeries are suggested in many situations to guard physicians against liability and malpractice lawsuits, and not really for the primary health of the patient. Another example, administrative complexity. This occurs whenever the billing paperwork, the charting paperwork done by physicians and nursing staff is not standardized across the board. So much time and effort goes into coordinating all of these different paperwork that are not standardized across the board that can be easily translated between departments, and that accumulates a great deal of waste. Pricing failures, for example, having one hospital charge a price for an MRI and then another hospital down the street charging triple the price. This occurs whenever hospitals decide their point of income that they would like to receive, and it's 20% higher than the hospital down the street, and we end up paying triple the price for the same product. Fraud and abuse. In a study done by Berwick and Hackbarth, the estimate of spending that was added into the healthcare budget simply by fraud and abuse was nearly $82 billion in 2011. So what can we do personally to eliminate these wastes? The first thing that we can do as patients and as consumers of healthcare is to demand value out of our care. When we demand value out of the care that we receive, we hold our physicians to higher standards in the care of quality, and this leads to better use of resource distribution. Second thing is volunteering at your local healthcare facility. There's many times that these facilities reinforce the 3 R's of recycling. They're reusing bed coverings and recycling them into making something else, bed sheets for patients, and all of these can be done by volunteers. And what's great about that is that when the majority can cut costs within the clinic, then we reap the benefits of those costs going down. The third thing is weigh the options before we commit to specific treatments. Most times the first suggestion can be the priciest. Nobody meanders into a car dealership and picks the first car the dealer offers. Why? Because it's the most expensive car on the lot. So asking for alternatives in those situations can lower the cost that we pay in, which lowers the cost that everybody pays in. Greater engagement of patients in their care has the potential to transform every dimension of healthcare. What are the benefits? The benefits are numerous. The first is nationwide cost improvements. The second is quality of care. Whenever it goes back into holding our physicians to a higher standard, forcing them to ensure that our care is of higher quality. The real cost of waste and error in patient care is the impact on well-being and the quality of life that we receive as patients. And that is our greatest benefit of eliminating waste. Thank you.